Welcome back, still at Daybreak Africa. Good morning once again. The topic today, endometriosis. Its awareness and its solution. Yes, at some point we'll be tempted to say it's more like a girl's topic this morning, so the men will probably just want to excuse themselves. I think the men should really sit down to and really educate themselves, because you have no idea whether tomorrow your daughter, your niece will probably tend to suffer from this disease, and you will just know exactly what is going on. So please, I want to join you guys to really sit down with the topic, both for the ladies, both for the men, so as to be better enlightened.
It's a family topic.
Family topic, that's the word, a family topic. So we have Dr. already seated, Dr. Olubusayo, in the house with us this morning once again. Welcome on the show once again, Doctor.
Thank you very much.
And I really want to use the opportunity to really appreciate you for always coming on for KAFTAN TV whenever we call you. It's part of your busy schedule. It's that you're traveling out of the country, you're coming back here, but once we call, you always find time for us. And thank you for meeting us once again this morning.
We appreciate you.
It's a pleasure doing that.
Yes. So when I did the intro, I started early in my family. We get matured very early. There was a situation where an aunt at 9 years was already a woman. For me, at 10 years, I was already a woman, and that trend has continued in my lineage. At 11, 12, in fact, by 8, I was so matured. When I was in secondary school, my first class, some people thought I was in my final. That's how mature we get in my house. But during that period, I suffered basically in my course of this research, every symptom that presents with this endometriosis condition. So today we want to create that awareness. We will want to start with an overview. As a medical practitioner, we want to start with an overview so people at home will understand what this big name is, endometriosis. It is a painful condition that often affects the ovaries, fallopian tubes, and tissues lining the pelvis. So we would appreciate if you give us an overview before we delve deeply into what it is.
Okay. So endometriosis. Let me start. The lining of the uterus is called endometrium. Uterus is the womb. And that's what is shed during menses. So it continually being shed, and new one keeps coming up. And so naturally you expect that lining to only be in the uterus. So when this lining or an endometrium-like cells find their way out of the uterus, that is where what is called endometriosis. So it can find its way to the fallopian tube, to the ovaries, to the bladder, even on the surface of the peritoneum. That is what is called endometriosis.
So how does this affect the woman's body?
Now, because that cell, the endometrium-like, is found outside the normal place, so it also responds to the hormone, the interchange that happens when a lady or a woman is to see its menses. So there's response in the womb, there's also response in the other places these cells are. And so once that happens, then they present with the barrage of symptoms that occurs with endometriosis.
So it can actually move and just begin to appear in different parts of the body.
It depends on how, the truth of the matter is that we can't say
Hmm.
this is the particular cause of endometriosis, but we know it occurs. There are a lot of theories. Well, we can't say particularly this is the known cause. For example, one of the possible theory is that the cells itself undergoes transformation by itself to the endometrium-like cells. That's a theory. There's a theory that also believes that it is through, probably through blood or through lymphatics that the endometrial cells, blood get to every part of the body. That somehow that endometrial cell got into the blood vessels. Because blood gets to all parts of the body, the endometrial cells now get to a particular place, it gets deposited there. It becomes endometriosis. That's another theory.
Mm.
There's also a theory that believes, they call it retrograde menstruation. Naturally, you expect the menses
to flow out.
To flow out. But instead of flowing, yes, it's now flowing up, getting into the tubes, and some getting into the ovary. These are all theories, but the truth is, we can't say categorically this is a known cause of endometriosis.
But why does it cause pain during menstrual cycle?
Yeah, because it is not in where the endometrial cell is not in where it's supposed to be. It's not only pain, there are other things. For example, if it's located around the rectum, then there will be severe pain when defecating. If it's around the urinary bladder, there will be severe pain when urinating. So it depends on the location. And so if it's in the pelvis, then of course you have severe pelvic pain.
Like in my own case, starting at 10 years to see my period, it was, my skin would turn red. I wouldn't be able to go to school for like 3 days during the period. I had heavy flow, pelvic pain. I had to my family will position me with like 5 hot water bottles to alleviate the pain. Sometimes it doesn't work. I'll be on the floor rolling. Then I'll keep stooling, which is something I discovered. So I was like, oh, doesn't mean all that while, because I was never taken to the hospital. Why? Because my mom said she too had the experience until she started having children, then it stopped. So would you say that was what I was going through?
No. One of the symptoms of endometriosis is painful menstruation. But it's not the only cause of painful menstruation, that which we call dysmenorrhea.
Mm-hmm.
Dysmenorrhea is either primary dysmenorrhea or secondary dysmenorrhea. So most of the time, I think what you add then, of course there was no diagnosis, it's primary dysmenorrhea. And most of the time is due to increased prostaglandin that causes it. And that's why for those people, by the time they start bearing children, they don't experience dysmenorrhea. But if you have been pain-free menses, and you now develop a fresh painful menstruation, that's what we call secondary dysmenorrhea. One of the commonest cause of that is endometriosis, even fibroid, or even adenomyosis.
Wow. So plenty.
Yes. So I think you probably had primary dysmenorrhea then. Yeah.
It was really terrible. One of the worst memories of my life.
A lot of people, a lot of ladies, and so because of the experience, the mother will tell you when you start giving birth, you won't.
Mine will come with nausea after, discoloration of my skin, hot
menstrual
temperatures. I'll be sick all through. I wouldn't eat. I wouldn't talk to anyone. I'll get so cranky. In fact, it's an experience best talked about and not even
But
seen.
now, it's not that people still don't have primary dysmenorrhea, but now because there is an understanding about the prostaglandin that is causing it. So most
Doctor, I try as much as possible not to cut your train of thought, because the more you go, the more I'll probably get lost. What is postglandin? What is dysmenorrhea? No, he wasn't explaining it. He wasn't explaining it. You were using those terms. And you use the term very often. What is dysmenorrhea?
Dysmenorrhea is painful menses.
Painful menses is dysmenorrhea. Why did you say so, doctor? What then is
painful menses?
Okay.
Painful menses.
All right.
So when it's primary painful menses, we say it's primary because there was never a free period that the person was not suffering from painful menses.
And secondary?
Secondary, that there were time before now, there was no painful menses. Now developing painful menses.
Okay.
That is caused by something. That's why it's called secondary.
I have a connection with my audience. When they're not really understanding it, I tend to feel it. So I knew the boys out there, I really don't get in this.
Because you are a guy. Yes.
See the way Ezekiel screamed. He almost jumped out of his chair. Like, what is going on here?
You give it times. Well, I understand,
then the prostaglandin, they are just chemicals produced by the body.
By the body. That causes so much pain.
Why not we use the terms instead of the medical terminology?
No, prostaglandin is the standard, because if I want to treat it true, I'm going to give an anti-prostaglandin. So that's what I was talking about. Now the knowledge.
There's awareness.
Yes,
now.
awareness.
Okay.
Now, so that's why you notice ladies now the pain is not as terrible as before. It's not that they don't, because before it starts, they will have used something anti-prostaglandin
to normalize.
So they won't feel, because that will control the prostaglandin. That's the chemical the body is producing, causing it. And so they live virtually near normal when they are having their menses.
Okay. So what then becomes some of the symptoms, basic symptoms of endometriosis?
Yeah. Pelvic pain. And most importantly, when they are having their menses, no. Terrible. Then now again, depending on the location.
It can be anywhere in the body.
If, for example, that endometrial lining is on the rectum, that's where we pass feces. Then there will be painful defecation. And most of the time, it will now be linked to around the menses.
That period.
Yes, because we know that lining, which we call endometrium. That's where the endometriosis got its name. The lining of the uterus is endometrium. So when there are hormonal changes, there are a lot of hormonal changes in a woman's body. And that is what culminates that they see their menses. And so now, that lining is in the uterus. But that same lining is in another place.
That's double.
So as the body, as the the lining in the uterus is responding to the hormone, the lining outside the uterus is also responding. And so if it's around the rectum, that's where we defecate. Then, apart from the normal pain with menses, all these things, we also be having pain
There.
around the rectum. So, and the simplest way is when you defecate, normal is not that the stool is hard or is giving you problem, you will still have pain. And if it's around the urinary bladder, that's this with urination. When you want to pay, there's no infection, there's nothing. And what you always notice that it's always linked to around the menses.
Wow.
Of course, we can have constipation, bloatedness, nausea, all these things.
So how is it then diagnosed, and what tests and procedures are involved in this?
And probably before we get to that, let's just talk about the family, the risk
type?
factors. No,
Risk factors.
risk factors.
Okay, that's it.
Risk factors. Let's talk about risk factors. Now, risk factors. Number one is family history. And so if your mother,
heredity.
yes,
Oh,
if your mother, so that's why one of the theories is genetics. If your mother suffered from endometriosis, you are likely going to suffer from endometriosis. 2, early menarche. I will explain that. When you start your menses very early. So probably your own case could have also been endometriosis. But why I'm not
Convinced?
convinced that it's endometriosis is that you didn't probably take any treatment. And you get, if it's endometriosis, you may have to take treatment. So early menarche and late menopause. Those who have delayed, you understand. Now in 40s, people stop seeing their menses. But if it's late to 50, late to 60,
70.
yes, they are also at risk. When the menstrual cycle is short, less than 28 days, it's a risk factor. When the menstrual cycle is long,
Wahala.
it's also a risk factor. Those are the possible.
What about
risk
estrogen?
Yes, high level. Yeah, you know, high level of estrogen is of course is a risk factor. Mind you, listen, because you know what happens in menses when it's interchange of hormone, female hormone, and the male female hormone is the estrogen.
So
That's
why?
the main. You know, estrogen is the main female hormone. And so, what happens in menses, all these things, is an interplay of those hormones, and the main one there is the estrogen. And so that is why it's so important in management. In fact, when we do medical treatment, one of the things they will probably be given is anti-estrogen, something against it.
So what about low body mass index? How does it? How comes
also
a risk factor?
That's also a risk factor.
Low body mass index.
Yes, there's no because we don't know the direct causes. Some of the things that is believed is that if there is low body mass index, that means the person, the weight over height, it's low, less than what is expected, then this will affect the estrogen. And if it affects the estrogen, then it has effect on endometriosis. They say obesity too on its own has effect on estrogen.
You should be predisposed to endometriosis.
Yeah.
What about the causes? I was able to find 1, 2, 3, 4, 5, 6 causes.
There's no known cause. They are all theories.
So you've told us about retrograde menstruation.
Genetics.
What about immune system condition? How can that predispose to this condition?
Yes, directly, because they are all theories.
Okay.
The possibility is that naturally, when something foreign gets to a wrong place, the body immune system is expected to fight it. So you should not take. So if there's a disorder from the immune system, then it will not fight it. So with that, that's why the lining stays where it's not supposed to be.
Surgical scar complication or surgical scare complication. How does
Yes.
that predispose?
Very good. Those are also possibilities. For example, you did a surgery on the womb. That's the uterus. For example, CS, mammectomy. You know, you get into the womb. During this time, you got access to the lining. Of course, if you are to deliver a baby through CS, you cut through the uterus. During this time, the endometrial cells got attached to the scar. That's a surgical scar. Then, of course, it can cause the symptoms. Because why is it endometriosis? Because that lining is outside where it's supposed to be. That's why it's endometriosis.
You didn't intend to attack the question as to how it is being diagnosed and
tests
and procedures involved.
A lot of things. We can do straight away examination, pelvic examination. That might not be as diagnostic as possible, but you can do ultrasound, pelvic ultrasound, and of course MRI. Yes,
do we really have those machines?
Ultrasound is available everywhere. MRI is not readily available and is very expensive.
So which one is available for Nigerians?
No, ultrasound is available and affordable. Available and affordable.
So the ultrasound, because you mentioned two tests now. So which one would someone need to do both, or the ultrasound can
ultrasound
be enough to diagnose?
Yes, from an experienced hand will be able to diagnose. Then you may have to do what we call laparoscopy.
What's that, sir?
Telescope. Yeah, it's a form of telescope, or it's used to do procedure. They probably take a little. It's a procedure. Take a little incision, put that laparoscope into it. They are able to look
from there.
Yeah. So they will tell you, endometrial lining is on. No wonder this person is having this pain. The endometrial lining is on the fallopian tube. The you are seeing it with, and with that, in fact, treatment can be done because you have seen it, and they try to get that lining out of the abnormal.
So does it affect fertility?
Of course, yes.
Is there options to conceive?
Or why does it affect fertility? Let's find out first.
No, because, there is inflammation every time, with the reaction of the endometrium. That's the lining of the uterus. Before you say I'm speaking grammar again. The lining of the uterus. Because if, for example, is on the fallopian tube, which is one of the commonest sites, what happens in the fallopian tube? That's where fertilization happens. And that's where pregnancy starts. Because that is where the male gamete, that's the sperm, and the female gamete, that's the egg or ovum, meets and it officially becomes baby there before it moves back to the womb where it's now get implanted and start to grow. And so because of the reaction on the tube, there's inflammation that can cause the tube to block. And so if the man is fertile and the woman is fertile, unfortunately, the male and female gamete is not meeting. There's no pregnancy.
Wow. For the sake of Ezekiel, we're going to take a break now, sooner than later, so we can take coffee, take tea, and Ezekiel can lie down for a few minutes so he can regain his strength. We're going on our break, and when we return, our doctor will be concluding on the discussion this morning. Please stay with us. It is still Daybreak Africa, where we're taking a look at a very important topic called endometriosis. I hope I got it well. Our doctor is still here. Before we went on the break, he was explaining how this condition can actually predispose to infertility, and that was where he stopped, and we'll really appreciate if we could continue on that note.
Yes, as I was saying, the commonest place you find it is in the fallopian tube, and that's where fertilization occurs. And so once there's inflammation, there's tuber blockade. And so even if we go back to infertility, one of the causes is tuber blockade. And so once there's blockade, the male and female gamete cannot meet, there's no pregnancy. There's nothing.
Now before we go any further on some of the more risk factors that can come out from this condition, are there different types? Because I was shocked while I was doing my research that there's something like grade 1, grade 2, grade 3 to grade 4. Are there different types of endometriosis?
Yes. When you talk about the stages like that, you are talking about the severity.
Okay.
Although some people still talk about probably superficial or deep.
So different from minimal to moderate to severe.
Yes.
Okay.
What they mean by superficial is, for example, if it's on the covering of the abdomen, which we call peritoneum, that is superficial. Then if it's in the deep organs, that is deep organ. Now, of course, the grading or staging is talking about how severe the condition is. So, of course, grade 1, virtually no symptom, to grade 2, to grade 3, of course, grade 4 is the hallmark, very severe disease.
There have been situations where women have had to take out their womb because of this condition.
Yeah.
Why? Is there no treatment for it?
No.
They'll willingly go and say, look, I just can't take it anymore. Doctor, please remove the womb. Remove it. Why? How?
Because it is known that, in fact, it's not only removing the womb, they will also remove the ovaries. Thus, with that person is virtually cured. Because I said majorly is on the fallopian tube, secondly on the ovaries. So if that is out, then the pain subsides and that person is healed. But mind you, if that person has not completed or has not even started family, that's a big challenge. And those are now the challenges that comes in. Even when you use hormonal therapy, of course, one of the managers, we are already talking about treatment now, where you take care of pain. Pain management is so important in the management of endometriosis because they have severe pain. So pain management is one. Then we can work on the hormone. There's hormonal therapy. Even using our popular combined oral contraceptive pills can assist. Of course, there are other drugs that gonadotropin, they work on that because that's what influences the ovaries to produce hormone, which have effect on the female reproductive organ. That's that. And of course, the third stage is surgery. It can be laparoscopy. It's minimal invasive. Just look, and if you pick it, the endometrial lining can be scraped out. Now, of course, your mark, if there's nothing to be done, of course, the womb and the ovary will be taken out. It's good if, for example, if the person has completed the family size, there's no problem to that. But what about those who have not even started making
babies? There's a situation on ground right now. A young girl of about 26. She's on social media screaming her head away, and she's saying, look, she can't take it anymore, that she needs the surgery, but her parents are against it, and now she's threatening to take her life. She's saying it's a life that she can't continue this way. She wants the surgery to remove because the doctors have told her that the only solution, apparently she has the severe case, that the only solution was that condition, and she's opting for that. What advice do you have for such a person if she's watching right now?
That person, she's 26.
26.
She's an adult. She can make decision by herself. You see, I know somebody close to me who had something. When she's seen her period, 3-4 days, she'll be indoor. She cannot come out.
That's the same situation I had.
Yeah.
For 4 days, I won't go to school. I won't see anybody. I'll be locked up in the room crying.
She cannot. Of course, ultrasound, everything pointed to adenomyosis. Adenomyosis is like endometriosis. But the difference is that the lining of the uterus is inside the muscles of the uterus. The lining is. So this one presents like a lot of people will think is a fibroid. And so even ultrasound, if you are not experienced, you may think it is fibroid. It also comes with the same symptom because the lining is not in the normal place. This one is inside the muscle of the womb. For surgery, they tried removing, but eventually, even I was one of those people, and we were thinking, well, hopeful, prayerful that she can. But at the time, she said she needs to get this womb out. And she did. And of course, she has not started
having children.
children.
Now, they say 1 in 10 women of reproductive age, 15 to 49 years, is sick with endometriosis. 176 million women today suffer from the same. That is huge. That is a huge statistic.
And we don't even diagnose. That's the problem.
I tend to wonder, you didn't really answer if there were options for women to conceive.
No, if the womb is out, there's no way she can conceive.
But if the womb is still intact, she could still conceive.
Yes, it's still possible. It's still possible. But once the womb is out, then the person will probably be thinking of adoption.
So what lifestyle changes could be adopted to manage the situation?
How can someone manage, like the young lady we're talking about, if she eventually, please, the reality that someone hasn't started a family, young, and is predisposed to such a condition, and the only solution at the end of the day is to remove the womb, knowing fully well, especially if that person loves to have children, have a large family. What do you say to those people? What kind of help can be given to such people?
That kind of person will need psychological support. So we need to see a psychologist, counselor. They need to work. This person must get prepared. It's so easy. It's easy when the pain is on. Are you getting my point? No. Get it out. I don't need it. But when it's done, the reality dawns.
This is it.
Oh, girl, you cannot have a baby. Yeah, that's another reality. But during the pain, one can say anything. Typically, when a lady is in labor, because of the pain, with her experience, they will be saying, "This is the last time. I will not." In a year, they are back. Because of the pain, you can say anything. But the reality when it does.
Doctor, please, let's laugh a little. At least let me try and calm Ezekiel a little, because I know he hasn't experienced this. There was a situation where my uncle's wife was admitted at the hospital, so I just went to visit, just waiting for my uncle to come back. And the woman happened to be in labor. When they were trying to pacify her, she was saying all kinds of things that I can't say on TV. But at that moment, the husband came in and she screamed, "That's the criminal! Yes. Arrest him! Police! Arrest the criminal!" Cheer up. You were the one who said this topic was a family topic. I don't know, now you're just holding your body together like maybe we're saying something that you've never heard before.
I'm trying to understand.
Ezekiel, they fall my hand on TV.
I'm trying to understand better, and plus the terminology this doctor has been using so far.
Okay.
I've not been using any
Ezekiel is falling my hand though. Seriously.
Let's talk about some of the common misconceptions. Because she claimed to have endometriosis at some point, but you say it may not exactly be that.
Since I got cured,
yes,
I didn't go for treatment.
Yeah.
So what amongst this could be other misconceptions people might have? How could we actually help dispel those misconceptions rather?
Because endometriosis comes with a painful menstruation. And so, is every painful menstruation endometriosis? No.
No, okay.
That you are a young lady, just started seeing menses, because I have called it menarche.
Okay, and I will be lost. I'll be lost once again.
Yeah. And because you have painful menstruation, is that endometriosis? No. It may be, but most likely it's not.
It's not. Okay.
So we must be able to differentiate between painful menstruation
and endometriosis.
Of course, endometriosis is one of the causes of painful menstruation.
What are the other symptoms? I discovered fatigue, maybe some other symptoms, and discover some other symptoms. Could you help us talk about other symptoms?
Mainly when you talk about the pain linked to menses, then of course there can be abdominal, there can be fatigue, there can be abdominal symptoms, there can be the person feel bloated.
I used to have that then.
There can be nausea. In fact, there can be vomiting too. And they can have premenstrual symptoms. They have pain. Before.
I used to have that too. So I will know that, oh, it is coming. My body changes completely.
Of course, there can be severe low back ache. They can have pains on the lap,
yes,
on the thigh.
Yes, I used to have that too. So
of course, there can be
mine was a miracle, probably.
Then again, no, because again with normal, what's it called? Primary dysmenorrhea, painful menses, you also have that.
Those symptoms.
Yes. So the only way I will be convinced that you had endometriosis is if we have had a diagnosis there.
Which you didn't have.
One. Then number two, you did not have any treatment.
Because my mom said
it went on its own.
Well,
so that's
she used
why,
to have it.
Well, except you think it's a miracle.
So obviously, I know this disease tends to affect relationships. Now, for the male folks who are seated watching and are probably asking, how does this probably concern me? And I said earlier, it could be your sister, it could be your niece, it could be your daughter, maybe
your
even
wife.
the wife.
Mm-hmm.
Now, for the male folks seated, how can he provide support for
the wife,
or for the
child,
daughter, or the sister? How best can the man support?
The man needs to be there for any of the ladies in her life having this condition by being there emotionally.
Well, the emotionally she mentioned was usually turned to curses and insults from her experience, because she said when the labor at some point and the woman was calling the husband criminal. So with that pain and that anger, is it more like being emotional to accept all she has to offer violently?
No. You see, the case of labor pain is different.
Okay.
Now, for example, somebody is down because of this, not able to do anything, virtually handicapped at that time. You need to be there to support, understanding, showing empathy, understanding what this woman or this lady is going through. That's what I mean by emotional support. If she can even tolerate food, I'm not sure she's able to even prepare that food.
Not even to eat it.
Is that now the kind of time the man is saying, I want to take pounded yam?
But some men would.
Are you getting my point? That's what I mean by being there emotional. She needs your support. You must understand what she's going through. At times, support can help in pain management. Support can help in pain management.
Maybe like rubbing the back,
simple thing.
Rubbing
I
the
need to
hand,
know
rubbing the legs.
somebody is there for you. And of course, if it is severe to the extent, for example, that married couples, 5-6 years, no child. Of course, the prayer again goes back on the man. But if the man is also there, supporting, well, there are a lot of ways that we can have our own children. If a child is adopted today, as that child, for example, has the rights. Of course, it's your child. Once it's established, you have adopted, all legal papers signed, it's your child. So, that kind of encouragement coming from a man to the woman, as a way of soothing that kind of woman. There's no problem. I'm going to stay by you. It's not that kind of time that you hear that the man has impregnated 3-4 people. The pain for that woman will increase 100-fold. That's what I mean by being there
And
for
support
the
him
woman.
emotionally.
Yeah.
So as we begin to round up on our discussion, I was shocked to discover while I was researching that there could be complications that could come beside infertility. Could you explain more on complications that can arise from endometriosis?
You know, depending on where it is, if it's on the kidneys, it can affect the kidneys. And what does the kidney do? Get waste products out. So it can affect the function of the kidney because it's there's recurrent inflammation where it is. The same thing with the rectum. Because of recurrent inflammation can eventually lead to obstruction. Of course, the main thing everybody fear most, of course, is the infertility. Because in our environment, making babies is important to our culture.
Can you predispose to cancer?
There's never in medicine. But once there are changes, we call it metaplasia. When a cell is transforming, then of course there's a possibility.
So at this point, what research is being done or carried out to better understand this treatment? Because, like you said earlier, everything is more like compounded in theories and
Yes,
nothing
because
definite.
no one course.
Yeah.
And that's why we need our scientists. Of course, I said we need our scientists. I'm not thinking about scientists in Nigeria. Why?
Why? Are you saying we're not able to do research or none is being done right now that you're aware of in Nigeria?
Well, I'm not aware. But you need to look at the environment. Virtually everybody is leaving the country. Why is everybody leaving the country? There's something wrong. The brilliant ants are leaving. That you see a doctor or you see a scientist, a pharmacist today, tomorrow he might not be there.
Do you have plans on leaving the country? I want to know. Do you have plans
That was direct.
of leaving the country?
Do I?
But you're here.
Yeah, that's the point. That's why I
I'm
asked.
still here today. Only God can decide tomorrow. But so what I'm saying is that, if the environment is conducive for research, look at it. You talk about what's it called? When COVID was in Nigeria, was there any vaccine produced in Nigeria? I'm asking, none. Everything was donor driven. Listen, the medications we use in Nigeria, where are they from? Majorly from India, Pakistan. Go and look.
So what's the problem? Is it that we don't have the minds to create vaccines?
The environment is not conducive to do it.
What does that mean in layman terms?
The government, listen, to research, you need a lot of funds and a lot of things. You need materials, you need resources. The environment is not conducive for all these things. And so that's why, you see, scientists, so easy. That's why when an Oyibo man notice you are good, they get you out. And you even forget your name.
Doctor, we want to appreciate you so much once again for being on the show this morning.
Thank you.
The discussion has been quite enlightening because for all my life I actually thought probably it has always been behind my mind thinking, did I have this condition and did not even do any treatment? So I thank you so much for the understanding.
Well, it's been a wonderful segment so
Yes.
far here on Daybreak Africa, and at
Yes.
this point, we're going to call it a wrap until we see you same time tomorrow morning. You have a wonderful day. I remain Ezekiel Ogar.
I am Anire Binitie. Stay safe and bye for now.